So in the global developing world where we work, the impact of COVID-19, Jason, has been much more than just the disease itself. The impact has been significantly much more in different areas. Let me give you an example. Food. Many countries responded in the early days around March and in April. They responded with close downs, limited movement of people. Some countries even put curfews of when you'd be allowed to be outside and when you'd be indoors, because everybody was trying to respond to this and limit the spread. One of the impacts of that decision in all the countries that we work was the fact that people suddenly realized, wait a minute, do I go out and try and make a living and eat, or do I stay indoors, be safe and die? And the people and the families and the children that we work with are already vulnerable. The majority of the families, they make their living day to day. In the urban areas, people have little businesses, little trades, whether you're a cobbler or you're a barber or you sell some groceries on the roadside trying to make a living. You work, you eat. You don't work, you don't eat. And many families, Jason, found themselves in that situation where the basic issue now was just food. And I remember watching here, and you could see queues of people in the food banks. But we don't have that in the developing. Where do you get a food bank in Togo? Where do you get a food bank in Ecuador? Or where do the poor people in Brazil go to queue for food? That didn't happen. So we closed down and assumed that people had food and they didn't have food. So one of the ways we've responded in compassion, obviously, was to figure a way of how do we support families with that basic necessity. And not just families, Jason. Even the church workers and even the pastors. Traditionally, when we have responded to a crisis, we respond to the crisis knowing that one part can actually respond to that crisis. So the local church institution can respond to a crisis of famine. But the pastors themselves were hungry, didn't have food. The church workers themselves were hungry, didn't have food. Now you have to keep in mind that the idea of refrigerators, where you can go to your Walmart or equivalent and buy food and come and stock it, doesn't exist in the developing world. And with the families that we serve, you buy food on a daily basis from the market. You have nowhere to store it. So the need for food, just the basic need for food, has been one of the significant needs that we have seen. We have had to respond to that, and we will continue responding to that. And then children, of course, are out of school. I am watching conversations around the world of, do we allow children to go back to school? Well, the United Nations actually estimates we have about 1.5 billion children that are out of school because of this COVID-19. Now, keep in mind that in the developing world, online network access, laptops in every home, that is a luxury, even for the middle class in those countries that we serve. Now, keep in mind that we're serving the most vulnerable communities.
Yeah.
They don't have the option of online education. And even if they had the option of online education, there's a presupposition that you may have space for a child to study. When you live in one room, multi-generations, where is that space to even study? So it is a huge problem. And as you know, education has got a long-term impact on the ability of a child, a family, to come out of poverty. So the interruption around education that we are seeing is going to be significant for the children and youth in our programs. And many churches that we're working with are trying to find local, albeit very limited ways of engaging that. I know of one country that is bringing 5 to 10 children at a time to the local churches to kind of provide some tutoring to make sure that they're not falling too far behind. I know some churches that are thinking, can we put some sort of a hotspot if we where we can, and have 3, 4, 5 tablets that children can borrow. One child in a family can borrow maybe this week and next the other, so that we can figure out how do we help address the question of education and the way it has been impacted, and will continue to be impacted until countries are able to return into their full normal way of life, if that is possible. But we're having these conversations. Children cannot return to school. And they cannot do online. We don't have those choices that we're dealing with. And of course, the other impact that, Jason, we have seen has been around healthcare. Many hospitals have been prepared and primed to deal with COVID. We are seeing the uptake on normal vaccinations not happening as normal, as typically would happen. Childhood vaccinations. People are afraid to go to the hospitals, and sometimes even the restricted movements hinder the ability to go to hospitals. So we are watching this very carefully, the questions of malaria and vaccinations and the other normal access to hospitals in situations where that hasn't always been actually the best. It's not like you have a 24-hour hospital in Bobo Dioulasso of northern Burkina Faso. And then you had this situation on top of that. So the impact on the healthcare is going to be something that we have to pay very, very close attention, because we're going to have to play catch up. For example, as I said, with vaccinations, we'll have to play catch up. I've been very impressed by the way the local offices that we have in our 25 countries, and the way the many churches have tried to respond. We have provided some PPEs, personal protective equipment, to some of the hospitals that we work with, because they actually don't have the resources to even buy basic things like masks or or gloves or sanitizers. And we've had to partner with those hospitals in order that those hospitals can actually not only just protect their own staff, but also be of service to the communities. Because remember, in the nations that we are working with, they don't have the wherewithal of the developed nations. When this thing happened, many developed nations, they put out stimulus packages that went to people that either were not employed, or to support businesses, or to support hospitals, because they had the resources.
Right.
That is not the case in the countries where we are working. There are no stimulus packages that are supporting the unemployed, that are supporting the hungry, that are supporting the children that need food, that are supporting hospitals. So we've had to respond in ways that traditionally we would not even head to because of this kind of crisis. So it is the impact of COVID goes beyond the disease itself.
Yeah.
And as a matter of fact, when it comes to the disease itself, we have been very, very fortunate. And I say fortunate knowing that it really is the work of God. We have not seen many deaths. We have had about two children in our programs dying. Very painful to see that. Around 240 deaths of family members, but family members of a family in poverty. That has got significant lifetime impact on those children growing up. So their needs just become that much more. And of the church workers that we partner with at the local churches, 13 of them have passed on. So I would, any death, Jason, is a death to be grieved. And especially when it happens in a context of poverty, the ramifications are a lifetime. But by the same token, I am really thankful that God so far has continued to watch. I have to say, I spent many a sleepless night as I was watching the international news and watching bodies being stored on trucks because the hospitals could not contain that. And for a moment, we had a situation like that in Ecuador, Guayaquil, where bodies were being left on the streets and families did not know what to do. Many of them ended up burying the bodies of their loved one in the back of their gardens. And I was worried, what happens if we see the same situation in Tanzania, in Bangladesh, if that happens in Togo, in these countries that don't have the resources, what happens? So God has been truly, truly faithful in ways that we didn't envisage. But make no mistake, this COVID-19 has taken the developmental gains we've made way back. Some people are estimating between 5 and 10 years of setbacks. And the fact that more people, in fact, it is estimated around another 50 million people are entering the category of families living in extreme poverty, meaning living on $1.90 and even less than that. So this is the first time that we are making negative strides in humanitarian development, and we're going to feel this impact. And the world economy itself is going to contract. Some are estimating by 3%, IMF and World Bank. So the impact of this on poor nations is not going to go away simply because we have found a vaccine.